Vanessa, what are the educational or informational resources available to primary care physicians and their staff and to patients and their families with these lipodystrophies?
Fortunately, there's a number of resources that are out or will be coming out. There's a number of key papers, one of which you were an author on, that is a great summary for lipodystrophy-related disorders. We often refer to that, and in fact, we know the advocacy community is looking at that very closely as well. There's resources available through NORD, National Organizations of Rare Disease. Again, educational components that can be used for healthcare providers as well. In terms of family support for lipodystrophies, there's a newly formed advocacy organization, Lipodystrophy United, and they're keen to continue engaging and networking with the entire community, both in the U.S. and abroad. One of the pieces I would say is to share a story from Lipodystrophy United regarding earlier diagnosis, or diagnosis as it may be. We hear quite often that women are picked up with lipodystrophy, particularly the partial or acquired form, but often men are not. Yeah. And we see quite a bit of underdiagnosis. We can look at our registry data and see very few men compared to how many women are in the system. And that's really a result of the physical changes, such that women may not typically seem as muscular, and that's a sign for their healthcare provider, but a healthcare provider looking at a man who's muscular, that's not necessarily an abnormality. So I would encourage the fact that even though we are seeing a higher proportion of women diagnosed, we're seeing a great proportion of males who are underdiagnosed right now in the community, and to raise that awareness. We also have registry data that's coming out. The Lipodystrophy United Foundation or group is sponsoring a lipodystrophy registry that will unite patients, again, being able to provide their data, being able to provide their health outcomes from the U.S., from Europe and abroad in a shared system that physicians can have access to, that patients can have access to. We also have one coming out for familial chylomicronemia as well. So that's newly launching and will soon come out to the community.
So we for a long time, we were providing some information to physicians and patients at our website, lipodystrophy.info at UT Southwestern. And I think you said it very clearly that males are clearly underdiagnosed. It's an autosomal dominant disease when we talk about familial partial lipodystrophies, and it should affect males equally as females. It should be 50-50. Although men may not be recognized, but they still are predisposed to insulin resistance and metabolic complications. So I think, with these support organizations and greater awareness, we hope that more and more men can benefit from being diagnosed early so that they don't have to face all these metabolic complications later.
I just wanted to mention here, it's not a medical site, but I have had the patients and families really get a lot of support from Facebook. There's a couple of groups on Facebook where the patients, the lipodystrophy patients, have come together, and I think even with the international patients, it seems to provide a nice forum where they can read the blog, and then they can sort of individually ask certain people questions, but it's actually an excellent resource for patients, because there's a lot of our patients that we care for on those Facebook pages, and they provide a lot of very good hometown experience with whatever treatment they're going through, and a lot of conversations where I don't have to be overseeing it. I think they can speak more freely.
When I see patients with rare diseases, I always encourage them to get involved in the chat rooms and the Facebook, and I tell them, I need to know 6,000, 7,000 diseases. You're going to teach me about your disorder. And the people on Facebook, the people in the chat rooms, they're going to tell us what needs to be done. And I think this is a fabulous improvement in rare disorders, the ability for people to link thanks to registries and these chat rooms.